Today's topic will be on anatomy of pulp cavity. So, what do you mean by pulp cavity? Pulp cavity is nothing but a central cavity which is present within the tooth. So, this red color area, right? So, this is your pulp cavity and it is present within the tooth and it is enclosed by dentine on all the sides except the apical foramen. Except the apical foramen, everywhere else it is totally surrounded by dentine. The pulp cavity is further divided into a coronal portion and a radicular portion. So I told you this whole thing is your pulp cavity. It is divided into a coronal and a radicular portion. So this is going to be your coronal portion and this is going to be your radicular portion. The coronal portion is called the pulp chamber. So which I have given it in violet in color is your pulp chamber, and the radicular portion is called the root canal. Okay. Now let's discuss in detail about the pulp chamber. This is I have tried to draw a three-dimensional view of the pulp chamber, and this surface over here is the roof of the pulp chamber. Okay, and it is also surrounded by dentine. Then comes the floor of the pulp chamber. Okay, this is going to be your floor of the pulp chamber. This is going to be parallel to the roof of the pulp chamber. Then what do you mean by pulp horn? Pulp horn is nothing but accentuation of the roof of the pulp chamber. So this is the roof I told you. So an accentuation will be present. Okay, this will most probably seen under a developmental groove or a cusp. So this is called the pulp horn. So at the floor of the pulp chamber, you will find what you may call the canal orifices. So these canal orifices are nothing but openings which you could see in the floor of the pulp chamber, which is leading into the root canal. So this is your root canal, right? So this is the canal orifice. Now coming to the walls and angles of the pulp chamber. Now the walls of the pulp chamber is usually the name is given corresponding to the tooth wall. Okay, so imagine this is your mandibular molar, this is the mesial side and this is your distal side. So if you want to name the wall of this pulp chamber, see this wall over here, yes, this wall which is present over here is present corresponding to the mesial side of the tooth. So this is the mesial wall of the pulp chamber. Say likewise, this is the distal wall of the pulp chamber. Angle of the pulp chamber would be, it would be formed by the walls which is forming the angle. If it is the mesial wall, the mesial and the buccal wall, and the angle which is formed by these two walls, you call it as the mesiobuccal angle of the pulp chamber. This what do you mean by root canal? Root canal is the portion of the pulp cavity which is extending from the canal orifice up to the apical foramen. So this area you call it as root canal. And the foramen which you find here, yes, or the aperture which you find at the apex of the root, and this is the area where the blood vessels at the nerves would enter the pulp and leave the pulp. This foramen or the aperture is called the apical foramen. So, what do you mean by accessory canal? See, accessory canal is, this is the main root canal, right? And if there is a branching of this main root canal, okay, this is called the accessory canal or the lateral canal. This will most commonly be seen in the apical portion of the root or near the furcation area. The root canal is divided into three sections. Okay, so one will be coronal third, middle third and the apical third. The openings which you see corresponding to the accessory canals is nothing but the accessory foramen.